cancerous white blood cell. His diagnosis is leukocytosis. Mr. K was resuscitated, revived for potassium or apparent death in the emergency room after experiencing a heart attack. Unfortunately, he suffered a broken ribs as a result of the physician's chest compression. This is an example of a iatrogenic fracture. After coming back from a trip during which he had eaten strange foods, Mr. Cameron had a disease of his intestine called enteropathy. K. Give the meaning of the following prefixes. Dia complete, pro before, out of, a and no not without, hyper excessive above, hypo deficient below, epi above upper, and endo within, retro behind, trans across, peri around, exo out, sub below under, re back. L. Underline the prefix in the following terms and give the meaning of the entire term. Diagnosis, complete knowledge. Prognosis, knowledge before. Subhepatic, pertaining to below the liver. Pericardium, membrane around the heart. Hyperglycemia, condition of excessive sugar in the heart. Hypodermic, pertaining to below the skin. Epigastric, pertaining to above the stomach. Resection, process of cutting back. Hypoglycemia, condition of deficient sugar in the blood. Anemia, condition of low red blood cell. Complete the following terms, describing areas of medicine, based on their meanings as given. A study of the urinary tract, urology. Study of woman and woman's disease, gynecology. Study of blood, hematology. Study of tumor, oncology. Study of the kidneys, nephrology. Study of nerves, neurology. Treatment of children, pediatrics. Study of X-rays in diagnostic imaging, radiology. Study of the eyes, ophthalmology. Study of the stomach and intestine, enterogastrology. Study of glands that secrete hormones, endocrinology. Treatment of the mind, psychiatry. Study of disease, pathology. Study of the heart, cardiology. And give the meaning of this underlined word part and then define the term. Cerebrovascular accident, damage in the blood vessels of the cerebrum. Encephalitis, inflammation of the brain. Cystoscopy, instrument to visually examine the bladder. Transhepatic, pertaining to across the liver. Iatrogenic, pertaining to producing by treatment. Hypogastric, pertaining to below the stomach. Endocrine glands, secrete hormones within the body. Nephrectomy, process of cutting the kidney or removal of the kidney. Exocrine glands, secrete chemical outside of the body. Neuralgia, nerve pain. Dr. Monroe told a new mother she had lost much blood during the delivery of her child. She had anemia and needed a blood transfusion immediately. Mr. Preston was having chest pain during his morning walks. He made an appointment to discuss his new symptoms with a cardiologist. Medical scramble. Clue, complete knowledge of a patient's conditions. Diagnosis. 2. Clue, outermost layer of skin. Epidermis. Clue, collection of blood below the skin. Hematoma, pertaining to treatment of the mind. Psychiatric. Clue, a study of malignant tumor. Oncology. Lesson 1. Section 1. How to use programmed instruction. The material in programmed instruction is arranged in a series of small steps called frames. Each frame presents new information to you or reviews material you may already be familiar with. Therefore, all of the following material is arranged in steps called frames. By checking your answer after you have answered a question, you will get immediate feedback as to whether or not you are correct. This immediate feedback will help you learn what is correct. If your answer is incorrect, you should reread the frame to find out why you missed the question. Fortunately, all of the information you need to correctly answer the question is contained within that frame. Programming instruction also allows you to learn at your own speed. If the material is difficult for you, you can go slowly. If the material is easy, you can go more quickly. Programming instruction is designed to proceed logically from one frame to the next frame. When working with programming instruction, you should not attempt to skip ahead because each frame is developed from preceding frames. That is why this type of material is called programming instruction. Section 2. Introduction to stems, prefixes, and suffixes. All medical terms can be broken down into word parts. The three word parts that you will be concerned with are the prefix, the stem, root, and the suffix. Usually, only two of these parts are present in a medical term. The word parts then of a medical term may include the prefix, the stem, and the suffix. The stem is the part of the word which gives the basic meaning to the term. The part of the word basketball which gives the basic meaning to the word is ball. Therefore, ball is considered to be the stem. The part of the word which comes before the stem and modifies or augments the meaning of the stem is called the prefix. In the word basketball, ball is the stem and basket is the prefix. The part of the word which gives the basic meaning to the word is called the stem. The prefix is the part of the word which comes before the stem. The part of the word which comes after the stem and modifies or augments the meaning of the root words is called the suffix. In the term specialized, special is the stem and ist is the suffix. In summary, words used in medicine are composed of one or more parts called prefix, stem, and suffix. The part of the word which gives basic meaning to the word is the stem. The part of the word which comes before the stem and modifies or augments the meaning of the stem is called the prefix. The part of the word which comes after the stem and modifies or augments the meaning of the stem is called the suffix. Lesson 2. Pretest number 1. Write your answer in the space provided in each question. Ophthalmalgia means pain in the eye. Orthoria is a discharge from the ear. Prenatal means before birth. Postfebrile means after fever. A salpingostomy is a surgical opening into a fallopian tube. Orthorexy means fixation of ovary. An enterolyte is a stone in the intestines. Hematuria means the presence of blood in the urine. Orchidectomy means excision of a testicles. Cystorrhagia means hemorrhage of the bladder. Ureterography means suturing the urethra. A cholelith is a gallbladder stone. A hysterosalpingo-oophorectomy means the excision of the uterus, ovaries, and fallopian tubes. Ureterocele means hernia of the ureter. Esthesia means feeling or sensation. Parophilia means an abnormal fear of disease. Megalomania is a mental condition. Osteopathy means disease of the bones. Cerebrotomy is an incision into the brain. Neuralgia means pain along the course of a nerve. Glycolysis is the breakdown or destruction of glucose. Edema means swelling. Acroparalysis refers to paralysis of the extremities. Tachyphagia is a word for fast or rapid eating. Splenopathy means a disease of the spleen. Lymphostasis means control the flow of lymph. An encephaloma is a tumor of the brain. Alipolysis means destruction or breakdown of fat. A piocele is a hernia containing pus. Dacryorrhea means excessive flow of tears. Cytology is the study of cells. Thrombus is the medical way to say blood's clot. Arterioplasty is a surgical repair of an artery. Phlebosclerosis is the hardening of the veins. Vasotripsis means the cruising of a vessel. An angiosperm is a spasm of a vessel. Hepatomegaly means enlargement of the liver. A proctoscopy is an examination of the rectum. Colocentesis means puncture of the colon. Jejunoileitis is inflammation of the jejunum and the colon. Psychosis means any serious mental condition. Enteroptosis means prolapses of the small intestine. Gastrectasia is the dilation of or stretching of the stomach. Hingivalgia means pain in the gums. The lacrimal gland secretes tear. Cheilosis is a disorder of the lips. A duodenotomy is an incision into the duodenum. Stomatoplasty means surgical repair of the body. Apnea means temporary cessation of breathing. Treatment with compressed air is called pneumotherapy. Laparorrhapy is the suturing of the abdomen. Glossoplegia is a paralysis of the tongue. Bronchorrhagia means bronchus hemorrhage. Nasal means pertaining to the nose. Rhinoplasty means surgical repair of the nose. Laryngitis is inflammation of the larynx. Onychosis means a condition of the naves. Costal means pertaining to the ribs. Abdominocentesis is a surgical puncture of the abdomen. Tendinitis is an inflammation of the tendons. Myocarditis is an inflammation of the heart muscle. Myelocele means herniation of the muscle. Chondromalacia is the softening of cartilage. Arthritis is a word which means inflammation of a joint. A tympanectomy is an incision of the eardrum. Keratocytasia means dilatation of the cornea. A pharyngotomy is an incision into the pharynx. Blepharoptosis means prolapse of the eyelid. Hemostasis means the act of controlling the flow of blood. A necroparasite is one that lives on dead organic matter. Pneumomycosis is a condition of lung infections. Section 2. Basic components. The main body or basic component of a word is called the stem or root word. All words have a stem. Even everyday words have stems. For example, in the words singer, writer, and speaker, sing, write, and speak are the stem. In medical terms such as hepatomon, gastrotome, and arthrotom, the hepat meaning liver, gast meaning stomach, and arch meaning joint are the stems. Certain combinations of stems are hard to pronounce. This is often true when a stem ends in a consonant and the word part that is added to it also begins with a consonant. This awkwardness of pronunciation makes it necessary to insert a vowel called a combining vowel. Certain combinations of stems or root words are difficult to pronounce, making it necessary to insert a vowel called a combining vowel. Usually the convenient vowel is an O, but occasionally it may be A,